Hello everyone. What you guys just saw is an illness that affecting people worldwide. It is simply known as Alzheimer's, the most common type of dementia. It is a continuous degenerative disease with no existing cure. You guys know approximately 204,000 to 264,000 elderly Malaysians are living with Alzheimer's in 2020. It became common as we age, affecting 8.5% elderly Malaysians.
In 1996, the Alzheimer's Disease Foundation Malaysia was established. This organization was proposed by a member of the Rotary Club of Shah Alam that had a personal experience with a loved one who is suffering Alzheimer's disease. There are many roles of FFDM. Firstly, providing education, support and advocacy for dementia patients. Secondly, promoting research and collaboration with international organizations in order to improve dementia daycare in Malaysia. In 2019, the government and all the authorities raising awareness and policy discussion. It is indicated that 264,000 Malaysians were living with Alzheimer's disease, making up 8.5% to 11% of elderly population. In 2020, this is when the impact of COVID on dementia patients. COVID-19 obviously affected dementia patients because of their isolation, disrupted healthcare access and increase of caregivers' burden. Therefore, ADFM shifted to online support program including virtual memory cafes and teleconsultation for the caregivers. According to the research from Malaysian Journal of Medicine, it is highlighted that the family caregivers face high emotional and financial stress. It is led to call for more government support. As a result, Malaysia explored the dementia-friendly community models that inspired from the countries like Japan and United Kingdom. In 2023, this is when the introduction of Malaysia National Dementia Action Plan. Dementia Action Plan focusing on many things. Firstly, early detection and diagnosis. Secondly, organizing public awareness campaign. And lastly, providing more dementia-friendly healthcare services. 1st October 2024, Malaysia Ministry of Health launched two plans. Firstly, 2023-2030 Elderly Health Services Action Plan. Secondly, 2023-2030 Dementia Action Plan. These two policies aim to enhance specialized dementia care in hospital, training for healthcare for workers, and financial aid for family. On 10 of February 2025, the National Dementia Alliance was launched to unite policymakers, researchers, NGO in order to combat dementia diseases in Malaysia. The Genting Dementia Care Centre in Kuala Lumpur became Malaysia's first large-scale dementia care hub. This is caused to increase the private sector involvement and financial aid program to help all the Alzheimer's patients in Malaysia.
We already know about the chronology of Alzheimer's. Let's move on to the symptoms of Alzheimer's. 1. Memory loss that disrupts your daily life, such as repeated questions or forgetting the information they recently learned. Number 2. Challenges in planning or problem solving, such as the inability to follow a receipt. Number 3. Having hard time completing familiar tasks, such as driving to workplace or organizing a process. Number 4. Confusion with time and place. Sometimes they may forget where they are and what are they doing. Number 5. Trouble with visual images and spatial relationships. This can cause problem guiding due to the depth perception. Number 6. New problems with words. In speaking or writing, it is hard for them to join a conversation to process the information.
The exact cause is not fully understood, but it is believed to result from a combination of genetic, environmental, and lifestyle factors. Some of the main causes and risk factors are brain changes and biological factors. The next cause is genetic factors. First, family history. By having a close relative with Alzheimer's patient, it can increase the risk of the disease. Other than that, genetic mutations. Rare mutations in genes like APP, PSEN1 and PSEN2 can cause early onset of Alzheimer's. The biggest cause of Alzheimer's disease is lifestyle and environmental factors. First of all, most of cases occur after age of 65. Cardiovascular health also can contribute to the Alzheimer's disease. Conditions like high blood pressure, diabetes, obesity, and high cholesterol can contribute to Alzheimer's by affecting the blood flow to the brain. Lastly, poor diet, such as diets high in processed foods and unhealthy fats can contribute to inflammation and cognitive decline. However, there is actually no cure for Alzheimer's disease, but treatments can help in manage the symptoms, slow progression, and improve quality of life. Treatment options include medications, lifestyle changes, and supportive therapies. Firstly, for modifications. Modifications can help in manage memory loss, confusion, and behavioral symptoms. Some of the medications is cholinesterase inhibitors. Cholinesterase inhibitors usually will be given for early to moderate stages patients. These drugs increase acetylcholine, a neurotransmitter that is important for memory and learning. And other than that, we also have Aricept, Exelon and Residine that can temporarily improve symptoms, but it does not stop the disease progression. It is a new FDA-approved drugs like aducanumab and lecanemab target amyloid plaques to slow progression. There is also gene therapy and stem cell research for brain regeneration.
There are several precautions we can take to prevent Alzheimer's disease. So first of all, regular health checkup. Regular health checkup are essential for identifying early signs of health problems such as high blood pressure or other potential issues before they become serious. These routine tests allow doctor to spot health concern early, which greatly increases the chances of successful treatment and can prevent complication. Early detection not only improves your chances of getting the right treatments to manage symptoms, but it also helps you better understand any chances in your health and provide access to any necessary support, benefits, or legal protection you may be entitled to. During a health check, your doctor will discuss your medical history, your family's history of disease, and factors like your diet, weight, physical activities and alcohol use, and smoking habits. Regular health checks are a proactive way to ensure you stay on top of your health and reduce the risk of developing serious condition in the future. Other than that, exercising for at least 150 minutes a week can have significant benefits for both physical and mental health. Regular physical activity can improve memory and cognitive function. Even if you don't have dementia, studies have shown that regular exercise can boost memory, attention, and thinking speed compared to non-aerobic activities like stretching. For individuals with dementia, less intensive movement like doing housework, taking short walk, or even gentle stretching during TV breaks can also provide cognitive benefits. Activities such as walking, swimming, jogging, biking, or even simple tasks like bringing in groceries or packing while waiting can all contribute to better brain health and overall well-being. Last but not least, eating a balanced diet is crucial for brain health, as certain nutrients can help protect the brain through anti-inflammatory and antioxidant effect. A healthy diet may reduce the risk of conditions like Alzheimer's disease by inhibiting harmful beta amyloid deposit in the brain or improving cellular metabolism to safeguard against disease. The Mediterranean diet, in particular, is thought to be beneficial due to its emphasis on fruit, vegetable, whole grains, legumes, fish, unsaturated fat like olive oil, and limited amount of red meat, eggs, and sweets. And this diet is rich in antioxidants, which can help protect brain cells from damage. To maintain good brain health, it's recommended to eat a balanced diet that includes at least 5 servings of fruit and vegetable daily, with a focus on colorful options like berries, as well as fish, nuts, seeds, legumes, and whole grains. This nutrient-dense food can support brain function and reduce the risk of cognitive decline.
To conclude, as humans, we play a vital role in maintaining our own health.
As the saying goes, an apple a day keeps the doctor away, reminding us that small, consistent choices can make a big difference.
After all, the greatest wealth is health, and an ounce of prevention is worth a pound of cure.
By nurturing our bodies and mind, we not only enhance our well-being, but also reduce the risk of conditions like Alzheimer's disease. So that's all from us. Bye.
Bye.